Informing, educating, empowering,
improving the way you do business in an industry that's anything but static.
You're listening to the Agent Survival Guide podcast. 2026 Medicare Part A and B premiums and deductibles. On November 14th, 2025, the Centers for Medicare and Medicaid Services, CMS, announced the Medicare Part A and Part B 2026 premiums, deductibles, and coinsurance amounts. Let's talk about what these numbers look like for the 2026 plan year and how these changes could affect your clients. We'll start out with Part B. For coverage year 2026, CMS announced a monthly Medicare Part B premium of $202.90. That's up $17.90 compared to the $185 Part B premium in 2025. The annual deductible for Medicare Part B beneficiaries also increased, up $26 from $257 in 2025 to $283 in 2026. What's behind the change? Projected price changes and assumed usage increases are two likely causes. In their official release, CMS mentioned that had they not addressed, quote, unprecedented spending on skin substitutes, the Part B premium increase would have been about $11 more per month, end quote. The CMS 2026 Physician Fee Schedule final rule added legislation concerning skin substitute spending that the Trump administration says, quote, is expected to drop by 90% without affecting patient care, end quote. Monthly premium increases or decreases are typically affected by the annual cost of living adjustment, or COLA for short. Other factors can sometimes play a role, and as far as pricing on Medicare Part A and B, we are seeing a larger increase in cost for 2026 than we did in 2025. As per usual, the Social Security Administration made their COLA announcement prior to CMS unveiling the 2026 Medicare costs. This year's COLA came in at an increase of 2.6%. in comparison to last year's 2.5% increase. In dollar amounts, the aforementioned 2.6% COLA means that clients can expect to see an increase of about $56 per check in 2026. Last thing we want to mention on Part B. In 2023, the Part B ID benefit was created by the Consolidated Appropriations Act. That was a piece of legislation allowing individuals on immunosuppressants to enroll in a special type of Part B coverage. Beneficiaries on immunosuppressants who are 36 months post-kidney transplant can still have their immunosuppressive drugs covered by paying a premium. In 2025, that premium was $110.40. It will increase to $121.60 for coverage year 2026. Next up, let's talk about Part A. Medicare Part A is premium-free for more than 99% of beneficiaries. Less than 1% of Medicare beneficiaries must pay the Part A premium because they do not have at least 40 quarters of Medicare-covered employment. Those who have paid Medicare taxes for less than 30 quarters will pay a Part A premium of $565 per month in 2026, up $47 from $518 per month in 2025. Beneficiaries who have paid Medicare taxes for 30 to 39 quarters will pay a Part A premium of $311 per month in 2026, an increase of $26 per month compared to the amount in 2025, which was $285 per month. The Medicare Part A inpatient hospital deductible that beneficiaries pay when admitted to the hospital for 2026 came in at $1,736, an increase of $60 from the $1,736 deductible in 2025. Part A coinsurance amounts will also increase in 2026. The daily coinsurance for days 61 through 90 will be $434 per day, and the daily coinsurance for lifetime reserve days will be twice that amount, running $868 per day for 2026. Skilled nursing facility coinsurance will also increase to $217 per day for 2026 claims. If you have clients who are considered held harmless, they will pay less than the standard Part B premium. The hold harmless provision states that certain beneficiaries' Part B premium increases cannot exceed the increase in their Social Security benefits. Clients who have higher incomes will be facing another round of high income-related surcharges for their Part B premiums. Over 65 million Medicare beneficiaries are enrolled in Medicare Part A, Part B, or both programs. These numbers are important to know so you can answer your clients' questions about cost of coverage and help them assess or reassess their coverage if needed. To see a breakdown of how your clients' annual incomes will affect their Medicare Part B monthly premiums for 2026, visit our episode notes for the link to the text version of this episode on the Ritter blog, as well as the official fact sheet from CMS. In the text version of this episode, we include a visual comparison between the Part A deductible and coinsurance amounts for 2025 versus 2026. And we also highlight the income brackets for the 2026 Income-Related Monthly Adjustment Amount, or IRMA, for Medicare Part B monthly premiums. I recommend checking that resource out and bookmarking it. Those tables are helpful to have at the ready when you need a quick reference. Always a great idea to visit our episode notes for links to resources we mention in the episode, as well as other relevant podcast episodes and blog posts. We aim to keep you as up-to-date as possible with information like this, especially when it directly impacts the ability of your clients to afford quality Medicare coverage. By staying current, you can serve as a well-informed, reliable, and trusted guide for your clients throughout the insurance sales process. And if you have questions about any of the stops along the way in that process, please reach out. We are happy to help. You'll find links to contact us in the episode notes, along with the information we mentioned in this episode and all the places you can follow along with our show. And we hope you'll take action on that as you're perusing the notes. Thanks so much for listening. We will see you next episode. The Agent Survival Guide podcast is a production of Ritter Insurance Marketing, an integrity company. Script proofing by Tina Lamoureux. Recording and production by me, Sarah Rappel. Podcast design by Urban Rivera. Follow along with our show wherever you like to listen. Rate and review our show on Apple or Spotify.